On the ballot this November will be a choice for voters whether to mandate a limit on the number of patients that nurses can care for in hospitals. Proponents of the Safe Patient Limits ballot initiative say the measure will ensure better care for patients. But those who oppose the measure, including nurses, say it would create wait times in emergency rooms, increase medical costs, and be bad for medicine. Yesterday, we brought you the proponents' side of this initiative, and tonight, Carolee McGrath brings us the other side. She sat down with Klucznik, Chief Nursing Officer and Vice President of Patient Care Services at Baystate Medical Center, to hear why she is opposed to the measure.
The Massachusetts Nursing Association, which is a labor unit that represents only 25% of the nurses in the state of Massachusetts, has been pushing this issue for the last 20 years and has really had no traction within the Senate or the House to date. They are really looking for people to sign a ballot to take this to the voters and the public, actually, to approve government-mandated ratios, which are actually quite rigid and very rigid and would have what I believe to be a negative impact on patient care going forward. And realistically, do I, as a registered nurse, want some government individual to tell me how to do my practice? We see every single day nurses on units, charge nurses, looking at the patients that we have on a unit. A patient's not a patient. Someone can be really sick, someone could be really healthy waiting for discharge. And so to say that you can only take care of this many patients during a certain time frame just takes away the nurse's professional judgment. And really, we are a professional practice, and we have the rights to determine how we should care for patients.
But of course, they're going to argue that this is going to improve patient care. And some people might say, hey, this is a great idea. If somebody's sick, if my loved one is sick, I want as many people and many eyes on him or her as possible.
That is the natural reaction. We all want more nurses. But the other thing that we do have to face today is that we are in the midst of a nursing shortage. So even today, the state of Massachusetts, the hospitals have figured out that we would need to recruit another 5,700 nurses. Where are they going to come from? How are we going to train more nurses should these ratios even go into effect? So it really impacts everything that we're doing. If we are forced to say a nurse can only take care of 1 to 4 patients in medical surgical areas or 1 to 3 in the emergency room, can you imagine what could happen to the public? I mean, access could be really limited.
And talk a little bit about wait times and how that could affect patient care.
Well, if a nurse in the emergency room can only see up to 1 to 3 patients at any given time, then patients would be waiting in the emergency room. Or ambulances might actually have to drive around to find another hospital that could actually take care of them. Baystate Medical Center is the only tertiary academic medical center providing higher level of care within the western part of the state. So for us, the western part of the state could really be negatively impacted.
How would hospitals handle this if this went through?
So I'm the chief nurse and I have budgetary responsibility. I have to look at all of my resources and make judgments, and I would because this would go into effect, we're being told January 1. That would give me a month and a half, 2 months to try to find 220 new additional nurses in addition to those that I have in vacant positions. Where am I going to find them? So I would be looking to other roles that nurses are case managers, nurses are in bed placement, we have a rapid response team that really helps determine if patients need ICU level of care. All of those roles would come into question. And then I'd have to look and say, do I have to close units? How many floors would I need to close to really make sure that I can be in compliance with this mandated ratio law? Because the bill also says that hospitals would pay a $25,000 fine per incident per day for every violation. So I think that most organizations would want to try to get into compliance as quickly as possible.
Now, obviously, you're not the lone voice that opposes this. Tell us a little bit about the coalition that you're part of.
The Coalition to Protect Patient Safety was started by the Massachusetts Health and Hospital Association in conjunction with the American Nurses Association of Massachusetts and the Organization of Nurse Leaders. Several areas, the Chambers of Commerce have signed on, other healthcare agencies have actually signed on, because the other thing that we're concerned about is, should this go into effect, we could be drawing nurses from other professions. So home care nurses might be coming to, we'd be competing for the same resources. So nurses that are in nursing homes could be affected, home care nurses could be affected. Our local states nurses could be gravitating from providing care within their state to come to work within, because we'll be competing for the same resources. So the coalition was started to really educate the public about the potential negative consequences to this law.
Tell us a little bit about the costs that would be associated with this, especially for patients.
So it is assumed that costs would actually, if you think about how are we going to fund this, it adds almost over $1 billion to all the hospitals across the state annually. That's on an annual basis. And where's that money going to come from? The assumption is it goes back to the patients to actually either in increased insurance rates, increased charges, just to fund all of this.
So those who are in favor of the ballot initiative say, listen, patient care is just going to be made so much better if this goes into play, and that, no, costs will not go up. How do you assure, people out there trying to make a decision that, what you're saying is really the best path to keep people safe in a hospital?
Well, there's no evidence in the literature that, yes, we always say, would it be good to have less patients to take care of? Yes, it probably would. But nurses can make that judgment within their assignments about who's really sick and who isn't as sick as another. We do it every day. California is the only state in the United States that has passed this legislation. They did that almost 20 years ago. They are lower ranking in healthcare quality for patient outcomes than Massachusetts, which is really in amongst the top ranking for quality. So I think that because Massachusetts actually publicly reports all of its quality data, its nursing sensitive data, we really are over and above from the quality that we provide to patients.
So are there certain mandated limits currently in hospitals in Massachusetts?
Well, in Massachusetts, actually, in 2014, we did implement a 1-to-1, 1-to-2 ratio within the ICUs. That's already a Department of Public Health regulation, so we follow that. If you look at labor and delivery, they follow the A1 standards for how many nurses can take care of mothers and babies. So for the most part, actually, we're following the guidelines that are established within any specialty most of the time.
Okay, Christine, thank you so much for coming in and explaining your position on this issue. And of course, it's one that we'll be following in the weeks and months ahead.
Thank you for having me.